If you've had an ACL tear and you're wondering what physical therapy and the rehabilitation process and that timeline looks like, this video is going to be perfect for you. My name is Dr. Garcia. I'm a physical therapist and the CEO of Sports Performance Physical Therapy, where we help people just like you overcome these surgery, overcome the barriers, and finally get back to the sport that you enjoy. So if you're looking for an ACL guide on what that process looks like so you can have certainty and confidence, you can overcome your fears, this is the right place. When you're looking at ACL rehabilitation, there's three things you want to consider, and I wrote those three things down for you here. So in physical therapy, that's typically what's going to happen after you have your surgery. There's a certain timeline that we have to review here. The first 6 weeks after surgery, you will be in some form of discomfort. That's just because of all the trauma to the local tissue. You'll have some bruising, which will all go away. You have stitches in those first 2 weeks, usually 10 to 14 days that you're going to have stitches in, and they'll remove those. If not, they've used glue. And in those first 2 weeks, you're typically on crutches, you're in a brace, and you start physical therapy early. Some surgeons will typically have you start within the first 3 to 5 days. Now, is this necessary to be able to get rid of the swelling and help you have less pain? It does help. Is it necessary in the long run? That's completely up to you and the surgeon and your timeline and urgency. If you want to be able to have decreased discomfort, less soreness, less swelling, that's going to be the best option for you. Next, in those first 2 weeks, you're going to be going over range of motion. This is where we start moving the knee real nice and easy. And once we have more range of motion and your swelling has gone down, from weeks 2 to 6, this is where we start to develop a little bit of what we call neuromuscular control. You start having a little bit more strength. You can actually move your thigh muscle a little bit more. You can start to see it start to develop a little bit more. We're working on your range of motion, and we're working a little bit on just getting the muscle to become more awake, because what typically happens after surgery, you lose a little bit of strength and a little bit of muscle mass, and you'll see that. This is where your thigh becomes a little smaller, and that's very normal. We'll get that back very quickly. After the 6-week mark, this is where you typically have most of your range of motion. You no longer have as much swelling, and your muscles are now active. This is where we can start to strengthen it from 6 weeks to 12 weeks. Now we're actually having you step up, we're having you step down, going up and down stairs, doing mini squats, beginning to challenge that knee just a little bit. So the first 2 weeks, work on the range of motion and getting the incisions to heal properly. From 2 weeks to 6 weeks, getting the muscle active, getting your range of motion full. From 6 to 12, we start to wake up all those muscles, work on balance, get you more mobile, get you more stable. Now at the 12-week mark, depending on your surgeon, you will begin the running process, or the return to run program, where we start you on a walk-jog progression, where you start with walking, and then you jog for 30 seconds, you walk for a minute, you jog for 30 seconds, you walk for a minute. This is all very normal because that knee hasn't been ready to accept all of that trauma or that tissue loading. Once we get you past that, for the next 4 weeks, we're going to have you start to work on running in a linear fashion. We're getting you to work on your impact activities. We're working on having you what we call deceleration, or slowing down and getting you ready for activity. And around that 16-week mark, so you're now at 4 months, you start to work on cutting and going side to side and feeling confident changing direction, because your ACL's primary role is to block the knee from feeling unstable going side to side. So at this point, the healing is strong. Your actual knee is feeling good again. It's stable. Now, at the 16-week mark, we start to look at return to sport criteria. So we start now. We've been running for 4 weeks. We've been cutting and pivoting for 4 weeks. Now we're going to test your ability to sustain whatever it is that you enjoy, whether that's tennis or soccer or baseball. We'll start mimicking those activities. And this allows you to feel comfortable and gradually get into your sport. So we'll have you doing maybe short kicks or small amounts of sprints side to side or forward or backward. And then we do that several times a week. Now, in this type of a criteria to return to sport, most surgeons will tell you anywhere from 9 months to 12 months. And the reason for that is because we started running from month 3 to 4, and we started getting you returning to sport from 4 to 5. Now, actually getting to your sport and feeling good and getting your conditioning back will probably be from 5 to 6. Now, from 6 to 9, you have this space where you now have to build your conditioning back up, you have to build your speed back up, you have to build your knee tolerance. There is a chance that your knee might slowly begin to swell, and this can be normal in certain instances, but ultimately you're trying to figure out how much your knee can tolerate safely. So the first one we covered was the timeline, the return to sport criteria. This is from typically 6 months and on. There's a small window from 6 to 9 months where you begin to develop all of that return to sport criteria, where you can go to modified practice, where you can, they'll put you on a bib or a vest to identify that there's no contact being applied to you, that you're purely working on what we call anticipatory movements, reaction movements, where you're not ready for the ball to turn in a specific direction, and can your knee tolerate those things, and do you feel comfortable doing that? At the 9-month mark is typically where they're going to start to add a little bit more contact if that's part of your sport. So now that you've felt comfortable doing it on your own, can you do it when somebody contacts you? This is a normal progression, and they'll do that for the next 9 to 12 months, putting you in peak conditioning, being able to safely get you there. Can you handle contact and not have any form of swelling? These are all things and markers of success that we're going to be looking at. So we looked at the timeline, we looked at the return to sport timeline as well, and the last one is the risks. The risks. Okay, so this is a big conversation that I have with a lot of the athletes, a lot of the clients here at Sports Performance Physical Therapy. In the end, we're medical providers. Our job is to lower the risk of you getting injured. We want to safely get you out to whatever it is that you want to be doing, but also lower the risk. Now, when we have these conversations, I will always ask, what does your life, what do you want it to look like in the next 1, 2, 3, 5 years? If it's important to you that you care about how the quality of your knee looks and lowering the risk, I say then it's better to go slower at the beginning. Do things right, strengthen your knee, get the range of motion, have it be safe, so that way when you get closer to return to sport, you know you did everything proper. Now, the risks are if you speed up the criteria at the beginning, or you don't get therapy early on, or you are inconsistent with your physical therapy rehabilitation process. And if you don't do that properly in the first part of the rehab process, your last rehab process won't be as ideal, and that's where the risky part comes. So there's a couple risks. Do the first 12 weeks of rehab properly. Next, do not go too aggressively when you're returning to sport. Do it nice. The riskiest time points for re-tears or re-injury is 6 to 9 months. And the reason for that is that graft, that ACL graft that was put in, is still being sealed down into the bone. It's still a little soft. And what we want to do is not risk that re-tearing. So take your time on the first 12 weeks and easy on 6 to 9 months. And that's typically where we see re-injuries. And if you're a parent, if you're an athlete who's looking at, okay, well, what does my year look like? What is the timeline? What's my return to sport? And then what are my risks? Those are all the important questions you should be asking. You should be in constant communication with your physical therapist and your surgeon to identify where the risks are, what's your timeline for your surgery, and then ultimately, when can you safely return to sport or do the things that you love, whether that's hiking or gardening, or what's a safe timeline for you. So there you have it. Whether you're navigating, you have a brand new ACL tear, or you're about to have surgery, this video is going to be perfect for you. Feel free to come back and rewatch it, make sure that you're on the right path, and then feel free to share it with anybody else that you know that this might help. So there you have it. Good luck on your rehabilitation process. If you have any questions, feel free to reach out via any of the links below, and we're happy to help. Good luck on your journey.